Okay, think about this for a second. What if the urge to write wasn't just a passion, but an unstoppable compulsion? Today, we're diving into a really fascinating neurological condition called hypergraphia. It's where that creative spark turns into an all-consuming fire.
So, to really get our heads around this, let's start with a simple but pretty powerful question.
I mean, really try to imagine that. It's like having an itch that you just can't scratch. But instead of an itch, it's this relentless urge to get words down on paper. Not for a deadline, not for a novel, but just because your brain gives you absolutely no other choice.
All right, so what do we actually call this? Let's take a look at the clinical definition of hypergraphia. The key phrase there really is beyond any requirements. We're not talking about a journalist on a tough beat or an author trying to finish a book. No, hypergraphia is this purely internal compulsion to write that has no external goal, no real purpose.
And that's such a crucial point when it comes to diagnosis. It's all relative. For somebody who rarely ever wrote, maybe just a grocery list here and there, suddenly filling up pages every single day is a huge red flag. It's this dramatic shift in behavior that signals a potential neurological change. I love this quote from the psychiatrist Emil Kraepelin because it really paints a picture. He noticed that for some people, this compulsion isn't even a burden. It's actually driven by a kind of pleasure. And that word astonishing, it gives you a sense of the sheer volume we could be talking about here.
So, what is actually happening in the brain to cause all this? Well, hypergraphia isn't a disease in itself. It's really a symptom of something else going on, and it's most often linked to a few very specific neurological conditions.
The number one cause, and the one that's most famously connected to hypergraphia, is temporal lobe epilepsy. But it can also show up during manic episodes, in some cases of schizophrenia, and, though it's much more rare, it can happen after a stroke.
What's really interesting is that the writing style itself can give us clues about the underlying cause. With epilepsy, for instance, the writing is often very coherent, very structured, and it might explore these deep philosophical or religious themes. Now you contrast that with mania, and the writing is like the written version of pressured speech. It's super rapid, it's energetic, and it's usually accompanied with other symptoms like not needing to sleep.
And this pattern just continues when you look at the other causes. In cases that are linked to schizophrenia, the writing can become pretty incoherent. It might be filled with delusional thoughts and something called neologisms, which are basically just made-up words. And what about a stroke? Well, that's the rarest trigger of all, and the writing that results is typically pretty minor. Sometimes it only shows up if a doctor specifically asks the patient to write something down.
So all of this brings up a really important question. How in the world do we tell the difference between this condition and, just being a really prolific writer?
The key difference really just